Winter Vaccines 101, where we hope to help you get answers that can help you protect yourself and your family. I'm Ed Bottomley with the Michigan Medicine Department of Communication. Today, we're going to be talking about everything from the annual flu vaccine and the updated COVID-19 vaccine to the new immunizations that just got approval against RSV and vaccines that protect against pneumonia, whooping cough, and more. All of these have something in common, which is that they aim to protect against diseases that often spike in the late fall and winter, and that spread most easily between people when they're indoors together. And with some major holidays coming up, with lots of gatherings, this is an important time to take steps to protect yourself, including getting vaccinated. Today's panelists include 3 physicians from across University of Michigan Health, which is the clinical care part of Michigan Medicine. This is our first live stream featuring experts from across our statewide network of care, and I can't think of a more important topic to focus on. So, on to our panelists. We have Dr. Dehart, who is Health West's Medical Director of Infection Prevention, Dr. Preeti Malani, a Health infectious diseases specialist who has special training in the care of older adults, and Dr. Stephen W. Martin, a pediatric critical care medicine physician at Health at Sparrow Children's Center. Now, before we start, just a few housekeeping items. You could submit questions at any time for our panel to answer during the Q&A portion of today's chat. Questions can be submitted by commenting on this video, but please note that your name or profile name will be visible to others. If you prefer a more anonymous option, you can send a private message to us via the Facebook direct message on facebook.com/Michigan Medicine, our flagship Facebook page. We know that there may be many questions, so we will likely combine some that are on the same topic. And please know that our experts can't give specific advice for an individual patient. Please also note that our experts today can't give specific advice about an individual's symptoms or care. If you have a question about what to do regarding your health or that of a loved one, please contact a healthcare provider directly. If you can't stay for the whole chat, or you'd like to share the recording with a friend, a video of the chat in its entirety will be available on our Michigan Medicine YouTube channel. So now on to the questions. Let's start with the basics. I'd like to ask each of you to speak to our audience like you would speak to a patient or a patient's parent or caregiver, and tell us what you most want them to know right now about the vaccines against these common fall and winter diseases. Dr. Malani, let's have you go first, followed by Dr. Martin, and then Dr. Dehart. So, Dr. Malani, over to you.
Yeah, thank you, Ed. And I'm delighted to be here, and especially to be with my colleagues, Dr. Dehart and Dr. Martin. My simple message to patients would be this: vaccines are safe and effective. My family is vaccinated, and I always recommend vaccination for my patients. And as we're getting ready to celebrate a number of holidays, this is a good time as you're planning meals and planning travel to also take a few minutes to plan for your health and think about how you're going to get vaccinated and when.
Fantastic. Thank you so much. Dr. Martin, over to you next.
Dr. Malani took a little bit of the words out of my mouth. These vaccines are safe and effective. While some of them are newer, I'm sure we're going to talk through the statistics as we go through this. But as a pediatric critical care doctor, I meet children and families on their worst days. Me sitting at the bedside telling a mother that I need to put a breathing tube in her infant who's having trouble breathing because of RSV, or telling the same thing to a mother of a teenager who has a secondary infection after influenza. Those are the worst days of their lives. These vaccines can prevent thousands of those worst days in the United States every year. That's what I want people to know.
Thank you, Dr. Martin. Now over to you, Dr. Dehart.
Well, we are on the same page, and I think I would emphasize what Dr. Malani said, is that I wouldn't recommend something that I don't recommend for myself and my family. And as Dr. Martin said, my granddaughter just got a slew of vaccines, just over 1 year old, and spent the night hardly able to sleep with fever. And by the next day, she was up and running around. And I have a colleague who just had their child in the ICU with RSV for 2 weeks and just wasn't able to get the vaccine in time because it just came out. And so putting those two together, they're safe and effective and can be life-saving.
Thank you to the three of you. Let's move on to our next question. Let's start with the newest COVID-19 vaccine, which was just updated in September and is officially recommended for everyone over the age of 6 months. If someone has already gotten vaccinated against COVID-19 before or had COVID recently, why do they need to get this new one? And what evidence do we have about what this vaccine does in terms of making illness milder or even reducing spread? And that's open to the three of you, whoever wants to jump in first.
I'd be happy to start just briefly. The newest vaccine is developed to try to address the newest strains that were circulating around the time the vaccine was developed. And as I think anyone knows, the strains are changing over time, but the seriousness of the illness hasn't changed dramatically. And these vaccines still seem to be very effective for the most important thing, and that's preventing critical illness and serious illness when people are infected. As far as when they recently had COVID, there are guidelines on how long to wait. Clearly, that matters. That's a good vaccination. And generally, the CDC, as I understand it, recommends you could wait about 3 months after a clear case of COVID to get the vaccine. But I'll turn that over to my colleagues, too, for anything else.
I would just add that what we've learned over time with these vaccines is that they're really excellent vaccines. Initially, they protected very well against all symptomatic infection. And what we found is that really the vaccine, what is doing, which is its job, is to prevent severe illness. And that has been very durable and throughout all the different alphabet soup of variants. And what I would say, the question you asked, Ed, is a really good one around transmission. And these are hard things to get at because it's really about reporting and, sort of what we call observational studies. But there are good data, and they've been published in journals like the British Medical Journal and others, where household transmission seems to be less. And again, when you think about where the greatest risk is, it's with the people you are with all the time. And whether it's people living together on a college campus, which is something I worried a lot about for the last few years, or if it's just a household, or if it's people visiting their grandparents, that having vaccination really helps protect those around you, not just you, which is an important thing.
Dr. Martin, anything to add on those?
No, I think that the durability was one thing that I wanted to comment on. There is a little bit of a wane in terms of its effectiveness, but it does last quite a long time.
Yeah, thank you all three for the answers there. Another vaccine that's recommended for everyone over the age of 6 months, every fall and winter, is the flu vaccine. Is it too late for someone to get it if they haven't already? And can they get it at the same time as their COVID vaccine? Dr. Dehart, would you like to take this one?
I'm happy to start on this. So no, it's clearly not too late to get the flu vaccine. I just looked at the data this morning, and our area of the country is surrounded by areas in our country where flu is expanding in the South, in the Deep South. Alaska, Puerto Rico, New Mexico are having significant outbreaks, and it will come our way. It always does. But I think as you mentioned earlier, the holidays coming up, influenza loves to travel. It loves to get in cars and go to family gatherings. It doesn't mind flying on planes. So it will be here soon. And if people can get vaccinated in the near future, they will have time to get enough immunity to make a real difference through the holiday season, which is when I think we expect things to really take off.
I would just add that also looking at latest numbers from the CDC in terms of vaccine uptake, and these lag a little bit, And I know some people do like to wait until about November to get their vaccine, with this idea of, well, if we see a surge in infections in January or February, the protection might be a little bit better then. But the number I saw for 65 and above, which is really one of the groups that has the greatest vulnerability for severe influenza, the uptake has only been about 57% overall. And it may be a little higher than that, but that still leaves more than a third of older adults unvaccinated at this time. So not just for yourselves, but of the older adults in your life and in your family, give them a call and remind them to get their flu vaccine. And especially before the holidays, we're, with travel, we become like one big melting pot. And I like the analogy that Dr. Dehart gave with, influenza loves to travel, just like all of us love to travel. And so don't bring it home and don't take it with you.
Ned, I didn't answer your other question about, can you get them together? The answer is yes. And it actually, there's been some data recently that may even be more of an immune response to get them both at the same time.
And then just to put a little bit of a pediatric spin on it, being the lone pediatrician here today, children under 5 are at very high risk for severe complications from asthma, particularly those under 2 years of age. Lots of kids will have prevention of moderate symptoms like sinusitis and ear infections, but things like inflammation of all the muscles, inflammation of the heart muscle itself, and inflammation of the brain can happen in these children too. So you can really prevent a lot of very serious complications by immunizing young children. And one other population that's really important to immunize is the asthmatic population of all ages. Our children with asthma who get influenza struggle to get through that disease. So it's very important.
Thank you. Thank you all three for those answers. Next question. A lot of people probably remember that last year at this time, there were lots of reports in the media about children, especially toddlers, and also older adults getting hospitalized or treated in emergency rooms because of RSV, far more than in previous years and far earlier. That has also spilled over to affect people who need other kinds of care. This year, we have new weapons against this disease. What are these weapons? How well do they work? And who's eligible? Dr. Malani, do you want to start by addressing the RSV vaccine for older adults, including some research you've done on it? And then let's have Dr. Martin address the options for infants and anyone who's in the last few weeks of pregnancy.
Yeah, I'm happy to get the discussion started. And as you mentioned, Ed, people may have not heard a lot about RSV until last year because there was a lot of attention given to it. And people like Dr. Martin and others were really having a difficult time taking care of all these very, very sick children who needed care. Hard time in the sense that there were so many demands for space, whether it was in the emergency departments or in critical care units or simply in doctors' offices. So RSV stands for respiratory syncytial virus, and this is not a new virus, unlike COVID, which is a newish virus now. But this is something that we're doing a better job of diagnosing because of the different tests that we do, both for influenza and COVID, and we also can diagnose RSV. And it's very important in that it creates a lot of hospitalizations for older adults, and the estimates are really between 60,000 and 100,000 a year, and really up to 10,000 deaths. Those are according to the CDC. And in most people who are healthy, who aren't little babies or older adults, and particularly vulnerable older adults, RSV might look like a common cold. You might be sick for a few days, cough, fever, shortness of breath. But in somebody who is more vulnerable, this can lead to things like pneumonia. And that's what we worry about, particularly in older adults. And this has been something that has been recognized for a long time in nursing homes. And as you mentioned, Ed, this is the great thing this year is that there's a new vaccine. The US FDA recently approved 2 different formulations, 2 different types of vaccine. And these are useful to prevent RSV in older adults, and this is 60 and above. And it's particularly recommended for those who might have underlying health conditions and respiratory conditions. And especially anyone who might be living in maybe it's a retirement community, or maybe somebody who's staying in a nursing home, or in the case of my family, grandparents with young kids who young grandchildren who go to daycare. So this is a new vaccine. It is available. I encourage people to find out about it and to get information. And Ed, you asked about some of the research that our team did. So these are data from the National Poll on Healthy Aging, which is based at the University of Michigan. And we simply asked people, and this was past July, have you heard of this vaccine? And this is people who would have been eligible for the vaccine, so 60 to 80-year-olds, and only about a half of respondents had heard about the vaccine. Now, the interesting thing is there was a lot of interest in getting the vaccine, particularly among those individuals who reported having chronic health issues. The ones who had heard of it were more interested, not surprisingly, but even people who had not heard about the vaccine were very interested in finding out about the vaccine and getting vaccinated. And I think, to me, I would just say that this really gets at the bigger issue of making sure that we raise awareness around RSV vaccination. And I know Dr. Martin's going to talk about kids. It may seem a little confusing because it's a little different in different groups, but for older adults, the key is 60 and above. And a lot of the pharmacies have this vaccine in stock. So while you're thinking about upcoming travel and upcoming vaccinations and health issues, this is another one to put on your list. So I'll turn it over to Dr. Martin.
Thank you. So we touched on it a little bit already, but RSV is a seasonal illness. In the pediatric population, it comes on between about September or October, and it goes till February or March, just about every year, although COVID did throw off our schedule a little bit. Last year was the hospitalization rate among Michigan infants and children was more than twice what it's been any other year in the last 10 years. So we saw a terrible RSV season last year, to the point where children were coming to the emergency department with RSV and never making it out of the emergency department because there was not a bed for them. They would stay their whole hospital stay in the emergency department. Preventing RSV among our infants really begins with mother. We don't think about usually immunizing young, healthy people against RSV because, as you already heard, it's often just a mild flu-like illness in a healthy population. But immunizing pregnant women between 32 and 36 weeks gestation who are anticipated to deliver that baby during RSV season has been shown to reduce the risk for that infant of getting RSV by 80%. I should say severe RSV by 80%. That's incredible. That's in the first 3 months, and it persists for the first 6 months of life at 70%. So that's really critical. The first possible intervention we can do is with mom. If mom is for some reason not able to get the vaccine or gets it and there hasn't been 2 weeks elapsed before the baby's born, we do have another new option this year. Historically, we did have an antibody, an immunoglobulin that was given to infants who were really high risk. So premature infants, cystic fibrosis, congenital heart disease, those sorts of infants, which required monthly injections and is very expensive. This year, the FDA approved a newer vaccine, the trade name's Beyfortus, works the same mechanism as that older medication with a different target molecule. And it has been shown to reduce the risk in newborns by 75% in their first RSV season. So that's also incredible. I mean, I think it's going to put me out of a job, but if we've got healthy infants, it's okay that I'm not working. So that is recommended for any newborn going into their first RSV season under 8 months of age, and any other child up to, I think it's 19 months, going into an RSV season who's high risk. So that's, again, the cystic fibrosis, congenital heart disease, former premature infants. So these are the two new tools that are out this year that I hope are going to dramatically reduce the number of infants that require hospitalization and death. Although in the United States, there are fewer than 1,000 deaths in infants from RSV every year, that's still too many.
Thank you so much, Dr. Malani, Dr. Martin. Dr. Dehart, I don't know if you have anything else to add.
I have a question for Dr. Martin. As an adult infectious disease specialist, I was always taught that the younger the child, the harder it was to get through RSV. Is that true? It's
That
younger
that is
children.
true. Yeah, that's completely true. So that's why we see that those children under a year of age, the group that this is recommended for, they definitely have the hardest time. It also increases your lifetime risk of asthma. So there are lots of reasons that if we can prevent this disease, we should.
Yeah, thank you for that question, Dr. Dehart. And thank you for the answers, Dr. Malani, Dr. Martin. So we've covered COVID, the flu, and RSV. Now let's talk about a kind of vaccine that many people may not know about. It's one that can help your body fight off bacteria that also cause nasty infections in the lungs, ears, sinuses, and also the blood and spine. These are pneumococcal bacteria, and there are several vaccines available for people of different ages, I understand. Dr. Malani, could you perhaps talk about the recommendations for adults over 65? And then Dr. Martin, could we have you address pediatric pneumococcal vaccines?
Yeah, I can try. And I will say this one's a little bit complicated and a little confusing because there are multiple formulations out there. And I can't emphasize this enough, is that someone who can really look at your vaccine record can make a specific recommendation in terms of what a particular patient may need or may benefit from. And so I think this is one where your doctor, your healthcare provider, or your pharmacist should look at your record to really determine this. But there are a couple different kinds of vaccines available, and this is recommended. So everybody 65 and above, and also for adults 19 through 64 who have certain health conditions, and those are listed. They're, these are individuals who have very specific health issues. And I will say this is one that gets missed a lot, and the uptake hasn't been quite as good. So while you're asking about other vaccines, think about this, because pneumococcal, whether it's pneumonia or another infection, can be a very, very severe infection. And there are vaccines that cover many of the more common types of this particular bacteria. And again, it's a little different in kids. And I know Dr. Martin will fill us in on this, but adults, this is one of several vaccines that are on the list for adults to get as well.
Ed, you already mentioned some of the types of infections that pneumococcus can cause, bacteria in the blood with or without a pneumonia, meningitis. These can be devastating types of infections for children. In children under 2, it is particularly devastating, and there are about 2,000 cases of invasive, so the bacteria in the blood, pneumonia or meningitis, about 2,000 cases of that in the United States every year. Carries a high risk of movement disorders and brain damage after meningitis, and their lung disease can be crippling for quite some time. So with that, the CDC recommends one of 2 vaccines. There's one that is aimed at 13 different serotypes of the pneumococcus, and one that's aimed at 20. Between those 2, they cover about 75% of the most invasive forms of pneumococcus, and they've been shown to greatly reduce the number of both serious infections, but also mild to moderate infections, things like sinusitis and ear infections. They have reduced the number of children who have to have ear tubes placed, which, again, if we can put us doctors out of business and those ear, nose, and throat docs don't need to be putting tubes in anymore, that's good for the kids. One other benefit is that if you have children in the home who are immunized, the infants that are too young to have a complete series are also somewhat protected, it's been shown. So more reason to immunize those children.
I'm just going to add to Dr. Martin's comment. Way back, and this is like 20 years ago, there was a benefit to sort of grandparents, from their grandchildren being vaccinated. And this vaccine is really interesting. It was developed, I believe, it was like a very late 1990s. And it was really developed around concerns around antibiotic resistance and things like ear infections and also, of course, the less, thankfully, very uncommon but very, very severe things like meningitis and others. But this was kind of a designer vaccine in that sense, that it was added to the childhood regimen in particular because of concerns about antimicrobial resistance.
Thanks for that, Dr. Malani, and thanks for both your answers there. Another lung infection common in winter that can be prevented with a vaccine is whooping cough, also called pertussis. People might think of this as something that mostly affects babies, but it's not just infants who should get vaccinated against it. Which of you can help us understand how parents, grandparents, childcare workers, and others can help protect babies by also making sure they've had a dose of the vaccine and how to get it?
I'll start off, but again, I'm a pediatrician, so I care about the kids. So the most common way for infants to contract pertussis is from an adult in their environment who has either no immunity or has waned immunity and then has an infection, which in a lot of adults can be just a chronic nagging cough without any severe systemic illness. In kids, however, particularly infants, again, we're talking under a year old who've been unable to complete the complete course of immunization, they can have so much coughing that it causes them to stop breathing, to have seizures, and to even die, which is why we immunize against it. So the CDC recommends that the pertussis vaccine be given at 2, 4, 6, and then again sometime between 15 and 18 months. And if someone's missed some, we have catch-up schedules that are also available on the CDC website. The adolescent population should get another one sometime around age 11 or 12 as well.
Thank you for that. Either of you, Dr. Malani or Dr. Dehart, want to tackle the other side of the question?
I'm sorry, which was that?
So we're talking about caregivers, grandparents, parents,
Sure.
perhaps getting the pertussis vaccine too.
Sure. So it's coupled with the vaccine for tetanus and diphtheria as part of a booster. And so that's a vaccine any adult should get at least every 10 years because of the risk of tetanus and diphtheria. And so in the past, we haven't always included pertussis in adults, but I think now that's a very common thing to do. And I've had adolescent family members with pertussis. I've seen young people go through it. And it's an infection that's just horrible to watch people go through, even when it's not, it leads to a fatal illness. So it's completely vaccine preventable, and it's easy to transmit without being very sick with it. It's the other odd thing about this is we carry the bug in our throats, and it may or may not produce a toxin. It really causes the disease, but we can spread it to other people without even knowing we're very sick. So getting that vaccine as part of your routine vaccines is just incredibly helpful to prevent disease for everyone.
And yeah, I'll just add that this is something that has really emerged in the last 10 years or so, where it's this notion of, they call it cocooning, the idea of, like, particularly infants, because they are so high risk and they're unable to breathe with this infection. And like Dr. Dehart said, it might be an older cousin, it might be an aunt or uncle that comes to visit the new baby, and they just have a lingering cough that hasn't gone away, and it turns out it's pertussis because their own immunity has declined. And it has to do with a lot of things in terms of how the vaccine has changed and how the schedules have changed. But I've gotten this call from friends, about, can my son come and visit the new grandbaby because he got his vaccine, but it hasn't been quite 2 weeks. And so, kind of talking them through, I said, yes, he should come. He should come and hold the grandbaby, and, can wear a mask if there's a concern. But again, none of us should be going anywhere if we're sick, certainly not around a brand new baby. But the pertussis vaccine has really been given in a lot of ways to help protect those infants. And those studies have been very important in terms of preventing such a severe illness in these little ones.
Thank you for your answers, all three of you. And it's fantastic when one of you speaking to see the other two nodding along. Just a quick time check. We're almost at about half past. We've got lots of questions to go. And just a quick reminder to our viewers that if you want to send a question in, feel free to comment on the channel that you're seeing this. Or if you prefer a more anonymous option, you can always send us a private message at the Michigan Medicine Facebook page, facebook.com/Michigan Medicine. So the next question that we have up. So we've covered the most important vaccines that can protect against infections in the fall and winter. Where can people get these? And what if they don't have insurance coverage or they need help scheduling an appointment?
I'll jump again. So if you go to vaccines.gov, right on the front page of that website, there are two searches, a link for search for COVID based on your zip code and which vaccine you need, and then also one for the influenza vaccine. They're both right there. It offers up pharmacies and health departments. So for those individuals who may have health insurance concerns, the health department is a good source in your community. And then obviously the first step would always be check with your own primary care doc and see if they have it or have a resource where they can get it for you too.
Thanks for that answer. I don't know if either of our experts want to jump in with any other information there.
Just want to highlight the role of the public health department. And I think people don't always think about their public health department as a place to go to be vaccinated or to get care. And again, during the pandemic, these departments worked, triple, quadruple overtime and really, I think, became more of a known entity. But this is a good place to go and to get vaccines, especially sometimes it's easier to get some of the things there than it is at your own doctor's office, depending on the vaccine. And of course, our pharmacy have become such an important partner in terms of getting vaccines done. For my own family, that's where we go because it's convenient. Ed, you asked about insurance, and this is a tough thing. I will say that there are resources to help get people vaccinated. Particularly, flu shots are available very relatively inexpensively. I think again, trying the health department as a resource, and if they can't do it, then maybe they have some other resources. And one thing to note too is that certain insurance plans, even potentially like some of the Medicare Advantage plans, you have to go to certain pharmacies. So sort of plan that out. I noticed that at the pharmacy, they're very good about this. They can do sort of a preview and check and make sure, because these vaccines, if you're paying out of pocket, can be quite expensive. And so, you don't want some small error in that way to result in a bill.
Yeah, thank you for that, Dr. Malani. Let's move on to our next question. The COVID-19 vaccines that most people received in the past 2 years were the mRNA vaccines made by Moderna and Pfizer. Both companies have come out with an updated variety for all ages above 6 months. But there's also a vaccine that's made in a more traditional way called Novavax, which is also available in an updated form for anyone aged 12 and up. Dr. Dehart, does it matter which one people get? And can you mix and match varieties? Would Novavax be a good option for someone who might not want to get an mRNA vaccine, for example?
That's a great question. So the first answer is just simply you can use any of the vaccines. They're all approved and all safe, all effective, they all work. In the past, we did a lot of mixing and matching, and primarily of the mRNA vaccines, Pfizer, Moderna, partly because which one was available as they came along. As these vaccines now, they've moved to formal approval from the FDA, they're being handled more like a routine vaccine. And so generally, the FDA is going to recommend if you're vaccinated with one vaccine, stay with that one. Part of that reason is from the very get-go, people may remember that when you got the vaccine, you could sign up to send any symptoms or anything you had to the CDC. Knowing these are important has been critical for us from the beginning. Nothing could have been worse than to not know about bad vaccine side effects. But now we know, with millions and millions, hundreds of millions of people vaccinated, they are safe. So anyone is safe. And I think the Novavax is a good choice. If someone chooses that, I certainly would encourage them to use the Novavax if that's their preference.
Thanks for that, Dr. Dehart. Let's talk about timing. This next question is about the timing of vaccines. How long does it take your body to use the vaccine to build up your immunity? Are there reasons to hold off on getting any of these vaccines, or to perhaps space them out if you've decided to get multiple ones that you're eligible for?
I can comment briefly. You know, the time frame that I think about is 2 weeks. And again, you know, there were like a lot of studies that got done where you drew blood on people, generally mostly younger, healthier people. Like, how long does it take to get the peak, you know, neutralizing antibodies? You know, I would say that, you know, again, there's sort of this practicality and there's this unpredictable aspect to it. And it may be that there's like a big event in your life, like there's a family wedding, there's a, you know, once in a lifetime trip, and or it's simply the holidays and you're getting together with a lot of family members, and you know, you want to sort of make sure that your immunity is like kind of as good as possible, understanding that sometimes you're still, you know, you can still have breakthrough, and I'm sure we'll talk about that. I would say, you know, a couple weeks is probably like roughly the time, but it's not like you don't have any benefit and then at 2 weeks all of a sudden it goes up. It's, you know, this is a bit of a linear process, but for most people it takes a couple weeks to sort of reach that full protection. And again, it does wane over time. That durability is there to protect against severe infection, to particularly hospitalization and death. And thankfully we're not seeing as much, certainly not a lot of death from COVID, which is wonderful. We you know, of course, haven't forgotten about what happened just a few years ago before vaccination was available. But again, in people who are more vulnerable, that idea of waiting, I discourage it, especially if you haven't recently had infection. Your protection's probably pretty low, and we've seen this anecdotally where older adults are the ones who end up sick enough to have to come to the emergency department. And again, entering respiratory virus season and the holidays, where, you know, some of the usual, your primary care clinics and things may have curtailed hours. It's just not a good time to have to go to the emergency department. It's never a good time, I will say, but it's particularly a difficult time.
Thanks, Dr. Malani. I don't know if Dr. Dehart or Dr. Martin have anything else to add to that question.
I can just say for adults and not for children, but that for me, sometimes it's a matter of convenience. I don't think there's a reason, if there wasn't an urgent need to vaccinate, that you couldn't space them out. But there is no reason not to get them together. And for me, it's just simply timing. If I'm going to take the time to go to the pharmacy and get the vaccines, which I'm doing a lot of now that I'm over 65, Dr. Malani, it just makes sense to get them together. It saves a lot of time, and it's perfectly safe and effective to do that.
Yeah, I would I guess third that. There's really no reason to delay them or separate them if you're in an eligible population. You know, my father is 83 years old. I like having him around. So when he called me and asked me if he should get them, I said, you should get all three: RSV, flu, and COVID as soon as you see them. So I would say that to anyone.
Yeah, I even last year I got my flu and COVID together just because, again, it's convenience. It's while you're there, just get it done.
Yep, same here. So next question, let's talk about the hours and days after getting these vaccines. What should people expect to experience or expect their kids to experience?
Dr. Dehart kind of answered this one earlier when he was talking. I think it was your grandchild.
Yes.
But yeah, soreness, redness at the site in kids who can tell you they may report a headache, some nausea or fever, muscle aches, that kind of stuff. But it's all short-lived, 1 or 2 days after the injection. And it's really the same for both ours, for the flu and COVID vaccines in children.
I would say that with flu, there's really very little, sort of downtime. I think, this is something that has been shown in really nice randomized studies where, vaccine versus placebo, like the same number of people kind of got sick afterward because these are given during a time of year when there's a lot of respiratory viruses circulating. With COVID, early on, and I think about that, it's coming upon 3 years for us as healthcare workers when we got our first vaccines. We were very fortunate to be some of the first people that were eligible to be vaccinated. And I remember really trying to plan, like, to be able to have a little bit of downtime afterward, thinking like, oh, I'm going to feel sick for a couple days. The last couple of boosters I've gotten, I haven't had that. And, I don't know if that's the experience others have had, but, I will say that, and I'm a mom of young adult children. And what I've recommended to them is like sort of, do it on a day when, the next day you don't have like a lot that you have to do, that, you can rest a bit if you're just a bit fatigued or you're just not feeling 100%. But again, this is the downtime, the recovery is really minimal. You just might not want to get it like the day before, like something really big in your life. But these are very available right now, and there's lots of places that you can get it.
Thanks so much for those answers there. We have an audience question. This is from our live audience on social media. It's about testing rather than vaccination, but it's a good question. We've all become familiar with PCR testing for COVID, which is considered really the gold standard for diagnosing the disease. Do we also have PCR testing for RSV?
We do. Yeah. We use a rapid ELISA test, but we also have PCR confirmatory tests that we use in the hospital for children. The ELISA tests, which are the rapid ones, are very reliable in terms of their accuracy. So if someone does test positive on one of those, we for our children at least, will not repeat a PCR test.
It's interesting. I'll just comment on the testing notion, because not too long ago, we didn't test anything. It was sort of like, in fact, a lot of times people, particularly older adults, sometimes got antibiotics because the assumption was they had bacterial pneumonia. And over time, we've gotten, this diagnostic catch of tests that we have has really grown. And I'd say, with COVID, people have gotten used to home testing. And we don't have widespread home testing for RSV and flu at this point. And who knows in the future what we might have. But the reason it's important to me as a clinician, one is that you don't have a bacterial infection, you have a viral infection, but that there may be certain treatments, and certainly for COVID and for influenza, there are treatments that we would give to anyone who is sick enough to be hospitalized. RSV is a little more complicated in terms of whether the treatments even work, and they pose certain risks. But in a very, very, very high risk population, like someone who's had a stem cell transplant, we may consider treatment. But a lot of this is to put a name on something that we used to just kind of call like a cold. And it has implications for sort of those around you, and it has potentially implications for treatment. And I will just remind people who are listening in, particularly with COVID, that people who are at high risk of hospitalization and death, they can benefit from treatment, especially when treatment's given earlier. And so that testing piece is really important, since that's the key to making that decision.
In the hospital setting, I agree with what Dr. Malani said. The testing often is to put a name on it, but there are many institutions where patients may have to be cohorted, and in which case knowing which virus someone has can help us decide what sort of isolation they need, not only to protect other patients, but to protect the caregivers, as well as who may be able to put in the same room if we do have patients that need to share a room.
Yeah, thank you for that. And again, it's always great to see everybody else nodding along as one of our experts is talking. Just a quick time check. We have about a quarter of an hour left. I'd really love your help in identifying misinformation that may have perhaps crept into people's social media feeds or conversations. Can each of you bring up a thing that people may have heard about any of these vaccines that's just not true and briefly say why?
I kind of like to go first, just in case one of the other guys took mine.
Go for it.
We didn't compare notes beforehand. So speaking specifically for the RSV vaccine given to mothers, one of the trials that showed its efficacy did have some infant mortality, which was posted on, I think it was Instagram, as the vaccine caused 12 infant deaths. But what actually happened was those 12 deaths occurred in the group where mothers were not treated with the vaccine. So I hope that is still not out there in social media, that this vaccine is dangerous to that unborn child. That is absolutely not what that study showed. Again, it was in the untreated mothers where there were some deaths in that study.
Thank you. That's a fantastic example.
I know one for me that has been all the way along with the mRNA vaccines is this is just a brand new technology that came out of nowhere. And as all of you probably know, the two people that were instrumental in developing that won the Nobel Prize in Medicine this year for that. But the interesting thing is, though the COVID vaccine was mentioned as a reason, one of the reasons why they got it, they really got it for developing the technology, which they had been working on for probably close to 20 years. And it takes that long for these things to develop. So this is just an example of people who are willing to work for years at basic science to understand things that might lead to things that really benefit people. And there's probably not been a better example of that in the recent time, other than perhaps the new treatments coming out right now for sickle cell disease and thalassemia. Same kind of thing, where research has been going on for years that's leading to a possible cure for those diseases. So it's where I just stand up and say, thanks to my basic science colleagues who work so hard to bring these things along.
I'm just going to add that really there's no end to the false information around vaccines. And again, it sort of peaked with COVID, and whether it was the vaccines causing infertility, vaccines changing your DNA, which they absolutely don't. And I think really what it gets at is that there's confusion and there's a lot of information. There's some mixed messaging, and particularly with COVID vaccines, the recommendations sort of were changing over time. And it was like, okay, you're done with 2 vaccines. Well, and then maybe a third. Well, everyone gets a third. And so I can see where some of the confusion could come in for people. And if they're nervous and then they hear a lot of stuff, they can get confusion. And what I would really emphasize is to really think about the source. And if you have questions, if you have concerns, really discuss them with a reliable source. Don't rely on, sort of some suspect thing on, really misinformation on social media, because there are some good sources on social media too. But this is one where you really owe it to yourself, you owe it to your family to make sure you're getting good information. And whether it's about, really could be about any vaccine, but in this case, we're talking about some of the ones, the RSV, the COVID, and as well as flu.
Yeah, thank you all three for your answers on that. Let's move back to the COVID vaccination. Do we know about the impact of COVID vaccination on the risk of hospitalization, long COVID, or death?
I can just get this started. The vaccine has been highly effective at preventing death and hospitalization, and that has been durable in people who've even had a primary series and not necessarily gotten boosted. I will say that I think the older you are, the more you have complicated medical issues. When we talk about people who are immunosuppressed, immunocompromised, whether it may be an organ transplant or another reason, Those individuals are the ones who that benefit might trail off quickly, and we were seeing hospitalizations, but it's remarkable how well this vaccine has protected against death and hospitalization. And again, getting that booster sort of increases that protection. Long COVID is complicated, Ed, and it's a whole conversation. I'd be curious to hear, particularly from Dr. Dehart, on this. There's some suggestion that there is attenuation of the course of infection, but to be honest, we still don't understand this as an entity and what puts people at risk. So I wouldn't say that it's clear that vaccines prevent this, but there's certainly a lot of observational data that suggests that. And I think we may need more time. But with hospitalization and death, that one is easy. I don't think anyone can argue with that one. The vaccines work.
I would just following up on that. Long COVID is something that it's being studied all over the country very carefully. It is, I think, an example of a number of different post-infectious syndromes that we've seen over the years. People who have gotten Lyme disease and been sick for a long time. Doesn't mean the infection is still there, but their immune system has an unusual reaction or not common reaction. This may be one of those as well. So it simply makes sense to me, though that's not proven medical science, that if we prevent some episodes of COVID, acute of any sort, symptomatic or asymptomatic, then we're going to prevent episodes of long COVID. So I think it's the best we have to offer to prevent long COVID right now is vaccination.
And just to add a little bit to that too, there was an observational study published this summer that showed that patients who already had carried the diagnosis of long COVID, if vaccinated after that diagnosis was made, did have an improvement in their symptoms. So I think there's still a lot of information to come in this realm, but I think the vaccines are going to prove very beneficial.
Yeah, thank you to the three of you for your answers on that. It's 12:51, so we've got a few minutes left. We've mainly talked about vaccines, but there are other things people can do to keep themselves and their loved ones healthy this fall and winter. Can you perhaps mention some of these other things that people can do?
I'm happy to start again. The biggest thing, and I hope we've all learned this the last couple of years, is if you are ill, do not go to a social event, into some crowded place, and expose a lot of other people. I think we have a culture around presenteeism, and whether it was going to school or going to work, and I will say that physicians are some of the worst. We've all probably worked when we were clearly ill and we shouldn't have worked, and I think even that has changed. That culture has changed, and we need to also think about that. There's a certain fear of missing out with social events, certainly the holidays. So I would say stay home if you're sick, to test yourself, because it's important, whether it's for treatment or whether you need to really just know how long you need to stay away from others. What I have recommended to people who are going to visit family members who are particularly vulnerable is to really be careful about your exposure before you go. To really start thinking a little bit like we did in the past, particularly before we had such great vaccines, is you might not want to go to a bunch of events before, going to visit someone who's more medically vulnerable, and to really think about that. And again, masks do work. If you're traveling, if you're in a crowded space, you're trying to avoid becoming ill or to take illness to your family members, this is a good time to think about, again, masks are tools, vaccines are tools, all these things are layered upon each other. It really kind of gives you an entire package to help prevent illness.
Thank you, Dr. Malani. Dr. Dehart, Dr. Martin, anything to add there?
Well, I loved what Dr. Malani said about layered approach. And one of the things anybody has seen on Facebook at some time, some example of why masks don't work. Well, masks don't work 100%, but there is nothing other than moving to an island where you're by yourself and no birds show up that works 100%, but all of them work. And I think people are reasonable enough now if they look at that evidence and say, I probably should wear a mask to this thing, or I maybe shouldn't go to this. If people did that, and we do everything we can do, from hand washing to masking, that sort of thing, that's what we really need to do. And it's a community thing. We all ideally need to take responsibility for each other and the people we work around, live around, be responsible about that.
I think my colleagues have covered it really well.
Awesome. Fantastic.
Hand washing is another one of those layers, that's
Right.
critical. So hand washing and hand sanitizer. So in my world with children, that sometimes is hard, because 1 second after you wash their hands, they're back in somebody else's face. But anyway, do your best with hand washing.
Yeah, thank you all three for those answers and for your expertise during this entire presentation. You know what? I always ask one final question while I have my experts on the line. Is there anything you think we've missed? Do you have any final thoughts? Dr. Martin, I'll go to you first if you think there's anything we missed, or you'd like to provide any final thoughts for the audience.
I don't have anything particular to think we missed, but I would like to just emphasize again that no child in the United States in our healthcare system should die as a infant or a young child. So these vaccines all are very valuable tools that can prevent hundreds, if not thousands, of deaths in our own country. So we need to utilize those tools and utilize them for every child. And those who can't have the vaccines will then be protected by those who do have the vaccines. So please, please strongly consider immunizing your children.
Thank you so much for that, Dr. Martin. Dr. Malani?
Yeah, Ed, I'm going to switch gears a little bit from infections to talking about health and well-being more generally. And the last few years have been very difficult for many of us for lots of different reasons. And I think especially folks who remain vulnerable to COVID and maybe have remained isolated and not quite 100% back to the day-to-day social activities. And, as we enter the holidays, social well-being is really essential. And so all the things we talked about today, the way I look at them is not as something that is oppressive or like, oh, I don't want to wear a mask. I mean, no one wants to wear a mask more than they need to, but to think of these as a way to really be able to safely gather with those who you love. And maybe you haven't been able to do that as much, particularly the last few years. It's been a little bit tricky. Last year was better, but the years before that were very difficult. So use these tips and tools as a way to really be together and to enjoy these holidays together.
Thank you so much for that. And over to you, Dr. Dehart, for any final thoughts or anything that we've perhaps missed.
I don't think we've missed anything, and I really appreciate the time that you've had, and my colleagues and you as well. Just that these vaccines are available, and take the effort to reach out, as Dr. Malani had mentioned too, to any family members that may just need to hear this, that hearing from you, hey, I love you, I want to make sure things are going to be okay for you, and just thinking about it right now. And again, as you asked, right now is the perfect time to do these vaccines. It will make a huge difference in the holiday seasons.
Well, thank you to all three of you. Thank you for all of you for joining us today. Special thanks go to our experts and to my colleagues working behind the scenes today to collect questions, make sure the live stream runs smoothly. The live stream will be available as a recording on the Michigan Medicine YouTube channel, and we hope that you share it with others. If you have specific questions about symptoms that you or your loved ones might be experiencing, we encourage you to contact your regular healthcare provider. We really hope this live stream has helped you understand your options for protecting yourself and those you love. On behalf of all of us across U of M Health, we hope you have a happy, healthy holiday season. Thank you very much.